Hi, my name is Lindsay McGee and I am the waiver manager at the Bureau of Developmental Services, BDS. These recorded training sessions are intended to provide information on each service available on the Developmental Disabilities, DD waiver, Acquired Brain Disorder, ABD waiver, and the In-Home Supports, IHS waiver. In this session, we will be discussing removable prosthodontic services. We will describe the service, talk about a scenario, and then provide any additional information that may be important to know about the service. The information in this session is applicable to the Developmental Disability Waiver and the Acquired Brain Disorder Waiver. How do the DD and ABD waivers define removable prosthodontic services? Removable prosthodontic services are limited to the provision of dentures, routine post-delivery care, and other associated procedures connected to the prosthodontic service that are not included in the New Hampshire Medicaid State Plan Service Adult Dental Services. Removable prosthodontic services are intended to assist individuals as a means to prevent functional limitations in order to support community integration and avoid isolation or institutionalization, and when, if not otherwise provided, the individual's health would be compromised through reduced food options and result in restrictive nutritional intake, impacting overall health, when considerations interfere with supported employment or social development. For example, an individual who has a severe dental deformity may receive treatment if during the person-centered planning process it is determined that the provision of dentures would enhance the individual's opportunities for community integration. So what does this mean and how does this help me achieve my goals? Removable prosthodontic services include providing dentures, routine care after getting dentures, and other related procedures that are not covered by New Hampshire Medicaid's adult dental service. These services aim to help individuals avoid difficulties in daily activities, stay connected with their community, and prevent feelings of isolation. So what this really means is helping individuals access dentures and all of the other pieces of dentures that goes along with that process. Now we will walk through a fictional scenario of an individual who is accessing removable prosthodontic services. Bobby is a 30-year-old man with a developmental disability who lives independently. Bobby enjoys painting, volunteering, and spending time with friends and family. At a recent visit with his dentist, Bobby's dentist recommended that he get dentures to help him eat and speak more comfortably. So how does Bobby access and use removable prosthodontic services? After the dentist appointment, Bobby called his service coordinator to discuss his appointment and that the dentist recommended dentures. His service coordinator let him know that removable prosthodontic services is available under the DD waiver. This service provides dentures and related care that aren't covered by the standard New Hampshire Medicaid state plan. Bobby and his service coordinator added this service to his service agreement. After this, Bobby calls his dentist and informs him that he is on the DD waiver and can get help with paying for his dentures. His dentist then works with Bobby on the next steps. So what is the outcome of this service for Bobby? Dentures have had a significant impact on Bobby's life. Bobby has found it much easier to eat different foods, which improved his overall diet and energy levels. He also felt more comfortable speaking in social situations, which has helped him stay connected with his community and avoid feelings of isolation. He remained active in his community, enjoying his hobbies and volunteer work, all while maintaining his independence and quality of life. Lastly, we will discuss any potential service limits and requirements that must be included in the individual service agreement. We will also discuss if this service may be provided remotely or while in acute care. When a service can be offered remotely, it means you don't have to be physically present at a specific location to use it. When services can be accessed in acute care, it means that individuals who are in a hospital or another urgent care type facility can still receive these important services. When waivered services have limits, it means there are specific restrictions or caps on the type, amount, or cost of services that can be provided under a waiver program. There is a service limit for removable prosthodontic services. This service has a limit of $1,500 per year and does not cover dentures more than once in a 5-year period. However, these limits are referred to as soft limits as they can be increased with prior approval from BDS. Removable prosthodontic services may not be provided remotely, however, they can be provided in acute care. For requirements in the service agreement, a goal is not required to be included, however, the need for the service shall be reflected. All treatment notes, imaging, prescriptions, and invoices should be made part of the individual's treatment record with the prepaid ambulatory health plan and be made available upon request to support any treatment that has been provided. Thank you. If you have any additional questions regarding removable prosthodontic services, please email bds@dhhs.nh.gov.